Welcome everyone to today's webinar. My name is Allison Barkoff and I lead the administration for community living. As I mentioned, we have ASL and CART, and you should be able to access that at the bottom of your screen. And I'll start with a brief visual description. I'm a middle-aged white woman with curly brown hair, wearing a blue suit and a white shirt with a blue ACL background behind me. We're thrilled to be hosting today's webinar for ACL's Disability and Aging Networks and the broader disability community with our partners at HHS's Office for Civil Rights to discuss the newly issued final regulations implementing Section 504 of the Rehabilitation Act. On May 1st, HHS announced the first comprehensive update in nearly 50 years to the 504 regs, which prohibit discrimination on the basis of disability and HHS-funded programs. And they truly built off the urgency and momentum created by the COVID-19 pandemic, where a spotlight was shown on the catastrophic consequences of the longstanding discrimination, inaccessibility, bias, and stereotypes in our healthcare and human services systems. And these regulations are truly groundbreaking, creating one of the most powerful tools we have ever had to combat disability discrimination in healthcare and human services, and tackling the significant health disparities experienced by people with disabilities. Updating this rule has been a top priority for the disability community since the first days of the Biden-Harris administration, and this rule truly reflects the lived experiences of disabled people and the issues raised by the disability community. The fact that we had more than 2,000 people registered for this webinar and over 1,000 on today is evidence of how important this rule is to the disability community. This rule is also the result of leadership. President Biden has supported agencies across the federal government in updating their disability rights regs, from HHS to the Department of Justice and the Access Board. And from the moment he arrived, HHS Secretary Becerra has had an unwavering commitment to advancing civil rights protections for people with disabilities and getting this rule done. My colleague, OCR Director Melanie Fontes Rayner, prioritized these Section 504 regulations, even while tackling so many other critical civil rights issues. And the team from OCR and ACL worked incredibly hard over the last 3.5 years in making these regulations into a reality. Today's webinar is about educating people with disabilities about their rights and covered entities of their obligations. And ACL is committed to working with OCR, ACL's networks, and the broader disability community in this important work. We have a webpage on ACL's website dedicated to this rule, acl.gov/504rule, where we have a link to the full rule, the OCR fact sheet, blog from ACL, and we'll be putting the recording up from today's webinar. And with that, I'll turn it over to my colleague, OCR Director Melanie Fontes Rayner, to give a few opening remarks, and then OCR's Molly Bergdorf will walk us through the final rule in more detail. Melanie?
Thanks so much, Allison, and thanks to our colleagues at the Administration for Community Living who have supported us throughout this webinar prep, throughout the rulemaking, and generally in our efforts to advance non-discrimination in health and human services for people with disabilities. Thank you to all of you today. It looks like we have a really big turnout. That's exciting. So as some of you may have seen, our office has been pretty busy the past few weeks, and we've rolled out a couple of critical final rules to protect the civil rights of people with disabilities in healthcare and human services programs, specifically Section 504 of the Rehabilitation Act and Section 1557 of the Affordable Care Act. Both rules work independently and together to ensure that all people have access to healthcare that is safe, accessible, and free from discrimination. Today, OCR, my office, the Office for Civil Rights, will specifically work to talk to you about the new protections and the new rule under Section 504 of the Rehabilitation Act final rule. This rule does a number of things. And as Allison noted, this rule is a testament to the work of many on this Zoom and across the country who worked to make sure that the Biden-Harris administration prioritized it. First, this rule ensures that decisions about medical treatment are not based on biases or stereotypes. It also, for the first time, implements a legally enforceable standard to ensure non-discrimination in the use of technologies that are routinely used in healthcare, including web content, mobile apps, and kiosks. The new rule also establishes standards for accessible medical equipment, things like scales, tables, and other equipment that will allow for healthcare to be more accessible for people with disabilities. The rule also discriminates the discriminatory use of quality of life adjustments or other analytical methods which may be used for cost containment, quality control, or algorithms that can impact a person's access to care and services. The final rule also clarifies that prohibitions on discrimination on the basis of disability apply to child welfare programs. Finally, this rule clarifies that recipients must provide services in the most integrated setting appropriate to the needs of the individual with disabilities. That's a very shortened version. And Molly Bergdorf from my team, who was our team leader on this, and I'm so grateful she's here with me today to talk to you about this and walk you through it in more detail. I'm so grateful for her leadership and work on this rule. But I want to end with just a quick note of thanks from my office to you. So thank you to all of you who advocated from day one for the need to prioritize this and to update these rules. You were relentless and you held our feet to the fire. And we're not done yet, and so you're not done yet either. But this final rule is really the result of your work and advocacy, and I'm so grateful for that. By removing these barriers to critical healthcare and social services, this rule will advance justice for people with disabilities who for too long have been subject to discrimination. No life should be valued less due to biases or stereotypes about a disability or simply because a person has a disability. Until this final rule takes effect in early July, the protections against discrimination on the basis of disability under the existing 504 rule continue to apply. If you believe you or someone you know has been discriminated against, you can file a complaint with my office. To file a complaint or request a complaint package and learn more about the robust protections of Section 504, you can visit hhs.gov/OCR. Before I turn it over to Molly, I forgot to give you a visual description of myself. I'm a middle-aged Mexican-American woman with dark black curly hair, light skin, green eyes, and I'm wearing a very light blue jacket today in my office. I'm going to go ahead and turn it over to Molly Bergdorf from our team to go in depth on this rule itself. And again, want to thank you for being here today and thank you for all of your work that you helped in putting this work together. Thanks.
Good afternoon, everyone. I'm Molly Bergdorf with the Office for Civil Rights Policy Division. I'm a white woman with blue eyes, pale skin in front of a blue background with the HHS logo. I'm wearing a black jacket over a blue dress. With that description in mind, I'm going to now post our slides and start walking you through some of the details of the 504 rule as Allison and Melanie have described. So just please bear with me a moment.
Molly, your screen is sharing, but I think you need to put it into slide mode.
Yes, thank you, Allison. Sorry, I'm working on it.
Molly, I'm happy to share the slides if it's easier.
That would be great. Not sure who was talking, but that would be appreciated. And I can
It's
just
the
say.
other Molly. Let me do it right now.
Oh, great. So Molly, I'll just say next slide when we're
Perfect.
ready for that. Okay.
While the Mollies are working on that, there we go. I was just gonna flag we'll work with Allison and her team to also do a briefing on 1557 downstream as well. So as like a sneak preview of what's to come.
All right, Molly, you're ready to go.
Team Molly, go. Okay, so this is, as you all know, we'll be discussing the new Section 504 rule under the Rehabilitation Act. Next slide, please. So Section 504 of the Rehabilitation Act prohibits discrimination on the basis of disability in any program or activity that receives federal financial assistance. Of course, the Section 504 law also prohibits discrimination in federally conducted activities, but today we are focusing on this rule, which covers recipients of HHS funding. And as Melanie and Allison referenced, HHS first issued the Section 504 regulations in 1977, and we've only minimally updated these regulations since then. So in order to clarify disability non-discrimination obligations and address issues that have emerged in our enforcement experience under developing case law and advances in statutory changes, both under Section 504 and with the issuance of the Americans with Disabilities Act and other relevant laws, including the Affordable Care Act, we've updated this final Section 504 rule. And we'll be talking about some of the details of exactly which changes we've incorporated in this final rule in this presentation. This will be a high-level discussion. We obviously can't get into all the details in the time allotted, but we wanted to give you a picture of some of the key elements that are most, we think, of interest to this network. For those who might have participated or watched the press conference on May 1st or had seen the press release, you know that the HHS Office for Civil Rights issued a final rule on May 1st. The rule strengthens civil rights protections for people with disabilities under Section 504. The rule was officially published in the Federal Register on May 9th and goes into effect on July 8th, 2024, with some exceptions that we'll discuss today. And as Melanie mentioned, until then, the protections against discrimination under the current Section 504 regulations remain in effect.
Molly,
Next
can you
slide.
turn your camera on?
Hi, everyone. So here's some details of the steps that had led up to this final rule. So on September 14th, HHS issued our notice of proposed rulemaking to update this regulation. Thank you for the many folks who participated in the public comment process, which closed on November 13th, 2023. We received over 5,200 comments from a number of individuals and organizations, including the entities that are going to be regulated by this new 504 rule, government officials, healthcare professionals, people with disabilities, and a number of other organizations representing various interest groups and private individuals. And we considered the comments that we received in developing this final rule. Next slide, please. So what's actually in this final rule? What does it change? The idea was to update and modernize the Section 504 rule prohibiting discrimination on the basis of disability, as we've talked about. And as I said, this rule covers recipients of HHS funding. We are working from the general prohibition on discrimination on the basis of disability in HHS programs, and we've added a number of new provisions that add specificity and clarification to strengthen these civil rights protections for people with disabilities. And that includes new provisions in areas like medical treatment, accessible web content, accessible medical diagnostic equipment, child welfare programs and activities, and a few other key areas that we'll highlight here. And another big area that we'll be discussing at some length are provisions that we've included in this rule to be consistent with other existing laws and regulations, particularly the Americans with Disabilities Act, the ADA. Next slide, please. So these are some of the key provisions that we'll be discussing today. Again, not a comprehensive look at the final rule, but some of the most important provisions and most significant changes under this final rule. These include medical treatment provisions, value assessment methods, child welfare programs and activities, web and mobile app accessibility, accessible medical equipment, integration, and the changes that I mentioned to be consistent with case law and legislative updates, including statutes as well as regulations, particularly consistency with the ADA. Next slide, please. So we're starting with the medical treatment provisions. So this is the new section 84.56. We know that discrimination on the basis of disability in accessing medical care leads to significant health disparities and poor health outcomes for people with disabilities. And in the medical context, we unfortunately know that denials or delay of care based on discrimination can have life and death consequences. As we discussed at some length in the proposed rule, there's also significant research documenting discrimination and bias by medical personnel on the basis of disability. So in this rule, the category of medical treatment is intended to be broad and inclusive, including, for example, services delivered as part of clinical research, crisis standard of care plans that determine prioritization of scarce resources in public health crises and other emergencies, organ transplant policies, and many other relevant areas. And just to get into some of the nitty-gritty of what the final rule does, under this new final rule, a recipient may not deny or limit medical treatment to a qualified individual with a disability based on bias or stereotype, based on judgments that the patient will be a burden on others, or a belief that a patient with a disability has less value than a person without a disability, and the life of a patient with a disability has less value than the life of a person without a disability. So what does that mean? For example, under the final rule, a medical practitioner cannot deny or limit clinically appropriate treatment where it would be offered to a person without a disability in similar circumstances. So, for example, denying a ventilator to a person with Alzheimer's disease who's developed pneumonia, when that's the standard treatment for pneumonia, because of the doctor's perception that that person has such a poor quality of life that it's not worth giving them access to that standard treatment. Or, for example, a medical treatment provider cannot provide treatment to a person with a disability when they wouldn't provide the treatment to a person without a disability in the same situation. So, for example, a woman with a disability seeks a prescription for contraception, but due to a belief from the doctor that any children she may have are likely to have that same disability, the provider offers only surgical sterilization to the woman when they would typically offer a prescription for contraception. That type of conduct would be prohibited under this regulation. However, the rule seeks to strike a balance with professional judgment of medical care providers. So, for example, where a medical provider has a legitimate non-discriminatory reason for denying treatment, that would not be discrimination under this rule. The medical treatment provisions also address consent and provision of information, just general typical information about treatment. There's a lot of details in this provision, and we have attempted to navigate case law, and we look forward to your further questions, providing technical assistance, and working with you, as both Melanie and Allison said, to be sure that the rule is implemented with integrity. Next slide, please. Value assessment provisions. So what we are talking about here are measures, assessments, or tools, and these are increasingly important for cost containment and quality improvement efforts in the healthcare context. We know that value assessment methods are used to influence access to resources, including medications, and the use of value assessment methods may lead to discrimination against people with disabilities when they place a lower value on life extension for people with disabilities. What does this look like in practice? Well, value assessment methods play an increasingly important role in determining whether a particular intervention, such as access to a drug or treatment, will be provided to a patient and under what terms. So, for example, even where a medication might be provided, does the person with a disability have to seek additional steps? For example, prior authorization or step therapy, which is a process where the patient is required to try a lower cost drug before they're actually given the treatment that was recommended by their doctor, which may be more expensive. What this new provision does is prohibits recipients from using a value assessment method that discounts the life extension of a person on the basis of disability. When that value assessment method is used in that way, discounting the life of value extension on the basis of disability, to deny or afford an unequal opportunity for a benefit or service. So that's a mouthful. In order to be prohibited under this provision, recipients can't use a value assessment method that discounts the value of life extension on the basis of disability and in a way that materially impacts access to a benefit or service. But I want to be clear, this new value assessment provision, which is the new 84.57, does not prohibit any specific measures or value assessment methods. It only prohibits the discriminatory use of a value assessment method. Next slide, please. Child welfare. Again, there's a general prohibition under Section 504 against discrimination on the basis of disability in all programs and activities funded by HHS. That's an existing obligation. However, despite that general requirement, we know that there's a lack of awareness of these obligations, as evidenced by the hundreds of complaints that OCR continues to receive and enforcement actions we engage in, despite technical assistance, guidance, and enforcement actions already taken in the past. So this new section, which is Section 84.60, specifically prohibits discrimination against children, parents, caregivers, foster parents, and prospective parents in the child welfare system. Let's get into a little bit more of exactly what this provision does. Discrimination on the basis of disability in child welfare includes decisions based on speculation, stereotypes, or generalizations. What might that look like? For example, removing a 2-year-old daughter from her parents at a hospital because both parents are blind, without any analysis of the ability of the parents to successfully parent or access to available support services that are typically available under child welfare programs. Recipients may not, under this rule, based on speculation, stereotypes, or generalizations, deny qualified individuals with disabilities custody, control of, or visitation of a child, or terminate parental rights or legal guardianships of a qualified person with a disability. Recipients also may not require children to be placed outside the home through custody relinquishment or other forfeiture of parental rights in order to receive necessary services. You cannot be forced to give up custody of your child in order to receive necessary services through the child welfare system. Recipients must also establish procedures for referral for people who need adaptive services or reasonable modifications within the child welfare program or activities. And the provision sets forth procedures for parent evaluations. Specifically, parent evaluations must be based in evidence or research, be conducted by a qualified professional, and be tailored to assess specific areas of disability-related needs. This final rule clarifies that tests and other assessments of parenting abilities must focus on parenting capacity rather than solely evaluating on an individual's disability. And as folks may know, through unfortunate experience, through the National Council on Disabilities Rocking the Cradle report or other sources, unfortunately, that is something that all too often has happened to parents with disabilities who have lost custody or had other negative ramifications only on the basis of a diagnosis a disability written on a chart without doing an individualized assessment of their parenting abilities. So that's what this provision in part is intended to prevent. Next slide, please. So now we're getting into two new subparts that adopt enforceable standards, as Melanie mentioned, for the first time to describe specifically what accessibility means. So again, people with disabilities were already required to have access to programs and activities funded by HHS. But what accessibility specifically meant has been left without a specific standard. And why is that a problem? Well, technology strengthens health and human services programs and activities in many ways, but when those programs and activities are provided through inaccessible means, like web content and mobile apps that people with disabilities can't access, that creates barriers for people with disabilities. So this new provision is intended to create a specific standard so that the accessibility requirement is easy to understand and easier to enforce. And I will flag that these provisions align with the Department of Justice Title II Web Access Rule covering state and local governments that some of you may be familiar with, that was just published as well. So what does the rule require? We adopt the Web Content Accessibility Guidelines, or WCAG or WCAG 2.1 Level A and Level AA, which is an internationally recognized standard for web content accessibility. So this new subpart I, which is where you can find these web and mobile accessibility provisions, requires that effective 2 years from publication of this rule, or 3 years for smaller recipients. So that means with those fewer than 15 employees, recipients must ensure that their web content and mobile apps comply with the standard WCAG 2.1 Level A and Level AA success criteria. We're adopting WCAG 2.1 Level A and Level AA as the standard for accessible web and mobile accessibility. Now, there are exceptions to this requirement. There's 5 exceptions included in this rule, including for archived web content, pre-existing conventional electronic documents, content posted by a third party, individualized password protected or otherwise secured conventional electronic documents, and pre-existing social media posts. Recipients can also use alternate designs, method, or techniques from the ones required under the rule if they result in substantially equivalent or greater accessibility and usability of web content or mobile apps. Recipients are not required to take actions that would result in a fundamental alteration of the program or activity or an undue financial and administrative burden. And recipients that are not in full compliance with these standards will be deemed to have met these requirements if they can demonstrate that non-compliance has such a minimal impact on access that it would not affect the ability of people with disabilities to use the web content or mobile apps. So we're trying to seek a balance here, a strong, clear requirement, but with some flexibility for entities complying with the rule and for long existing significant existing materials. There's a balance of what the requirements are, but the bottom line is that we are adopting an enforceable standard that will be in effect within 2 or 3 years, depending on the size of the covered entity. Next slide, please. Accessible medical equipment provisions. This is another provision where we're adopting an enforceable standard for the first time. Why is this important? Well, we know that people with disabilities experience barriers to medical care because of inaccessible medical equipment, as we heard in the comments received, to the tune of people who reported never having had a successful basic opportunity to climb onto or be able to use the examination table in their doctor's office, had never had access to a pap smear or a mammogram. These types of barriers that result in inequities and exclusion from basic health services, contributing to poor health outcomes. Meaning, if you aren't able to get your weight because you're a wheelchair user and there isn't an accessible scale, it has all kinds of impacts on just getting access to the basic healthcare services. We were aware of this based on complaints received, based on, again, reports that we read, and we heard it resoundingly from the comments received in the public comment process of developing this rule. So what does the rule actually do in response to this issue? We have, as I mentioned, adopted an enforceable standard. In this case, it's the standard developed by the Access Board as required in the Affordable Care Act. The US Access Board developed standards for medical diagnostic equipment in conjunction with the FDA as required, and we are adopting them here in this new subpart J. And I will also mention this provision aligns with the Department of Justice NPRM under Title II of the ADA on this topic as well. The NPRM was published in January 2024. We are aligning standards so that there will be consistency between the Department of Justice and HHS on this issue. What do we actually require? So the new provision requires newly acquired, that can mean purchased, leased, or otherwise acquired, medical diagnostic equipment to meet these standards that were created for medical diagnostic equipment by the Access Board until the recipient satisfies the specific scoping requirement, which is 10% for most healthcare providers, 20% for facilities that specialize in treating conditions that affect mobility, but no fewer than 1 unit must meet the MDE standards as the recipient acquires new medical diagnostic equipment. There's also a requirement that accessible MDE must be, and when I say MDE, that's just shorthand for medical diagnostic equipment. Accessible medical diagnostic equipment must be dispersed proportionally across departments. Within 2 years, every recipient that uses examination tables and/or weight scales must acquire at least 1 examination table or weight scale that meet these standards. However, recipients are not required to take actions that would result in a fundamental alteration or undue financial or administrative burden. Recipients are not required to make each piece of MDE accessible and are not required to acquire MDE to achieve program accessibility where other methods are effective to achieve compliance. And there's an additional requirement that recipients have to ensure that they have qualified staff able to operate accessible MDE, assist in transferring and positioning where necessary, and to carry out the access obligations regarding their existing medical diagnostic equipment. Next slide, please. To the integration provision. The final rule reflects principles established through the Supreme Court's Olmstead decision and other significant court decisions, and clarifies that services must be provided in the most integrated setting appropriate to the needs of individuals with disabilities. So as Melanie had shouted out this obligation to provide services in the most integrated setting appropriate to the needs of the person with a disability, that's a longstanding requirement in Section 504 that actually even predates the Americans with Disabilities Act. However, in this landmark decision, Olmstead, in 1999, brought by 2 women in Georgia, both with intellectual disabilities as well as mental health issues, the Supreme Court established the principle that unjustified isolation of people with disabilities is discrimination under the ADA's Title II mandate, what that applies to state and local government entities. And as you may know, most recipients of HHS funding who are covered under this rule are also subject to the ADA requirements. And the obligations under the ADA in Section 504 have been interpreted consistently with claims brought under both laws in court and generally treated identically by courts. So what we are doing in our new Section 84.76 on integration is include details to help recipients better understand and comply with these obligations under the integration mandate under Section 504. So we're providing more detail about the right to be served in the most integrated setting, what it actually means. To get to the nitty-gritty, we describe in this new section what segregated settings are and include a non-exhaustive list of specific prohibited actions. These are prohibitions that apply to the extent that the action results in unnecessary segregation or the risk of such segregation. The rule underscores that people with disabilities need not wait until the harm of institutionalization or segregation occurs to assert their rights and avoid unnecessary segregation. However, recipients are not required to take actions that would result in a fundamental alteration in the nature of the program or activity. And for those who are closely following the provisions of the rule, for your awareness, we did make changes to this section in response to comments received, including removing the phrase unnecessary segregation from 84.76B in response to comments received. So we heard you, we reworked the provision to try to be more clear about what we're requiring. And then finally, I want to be sure to flag that there's also a definition in the definition section, which is in another part of the rule. Definitions are found in section 84.10, but we include a definition for most integrated setting. And we did that to align more closely with the description of most integrated setting in the Department of Justice's Title II Olmstead guidance. So this final rule adds to that definition language that these settings provide opportunities to live, work, and receive services in the greater community, like individuals without disabilities. So we've updated the definition of most integrated setting from the NPRM. Next slide, please. Judicial and legislative consistency. So as I mentioned, we made a real attempt in this final rule to approve consistency between Section 504 and a number of legislative statutory developments that have happened since these rules were enacted in the 70s, most prominently including the Americans with Disabilities Act. And so, as I already mentioned, many entities covered by this Section 504 rule are also covered by the ADA. And we've incorporated specific additions and new provisions to try to eliminate uncertainty and confusion caused by differences in what was the Section 504 rule from the department, HHS that is, and the ADA regulations. And there's a number of changes that we made for consistency with the ADA rule, including a broadened definition of disability, clarifications regarding reasonable modifications, additions on maintenance of accessible features, provisions on retaliation and coercion, personal services and devices, service animals, direct threat, effective communication, and also the limitations of fundamental alteration and undue financial and administrative burdens. You've heard me say that throughout the rule. Fundamental alteration applies almost everywhere. Undue financial and administrative burden also applies not everywhere, but broadly, because these were balancing provisions that were included in the underlying laws, particularly the Americans with Disabilities Act, to try to ensure that discrimination is prohibited, but to not be too burdensome in implementation. So the 504 rule includes many of these provisions from the Americans with Disabilities Act, including these limitations. And I also just wanted to flag specifically in this final rule, there were some changes to the definition of disability, which is found in section 84.4. We updated some language that was outdated or could be considered pejorative in the final definition of disability. Next slide, please. So how will this rule be implemented? As I mentioned, it will go into effect on July 8th, 2024, except where there's another timeline. So for accessible web content and mobile apps, it's a 2-year or 3-year phase-in, depending on the size of the recipient. If you're a smaller recipient, meaning you have 15 or fewer employees, you have 3 years to comply. Everybody else has 2 years to meet the new standards that we've adopted, as discussed, the Web Content Accessibility Guidelines, Level A and AA. Web Content Accessibility Guideline 2.1. I don't know if I mentioned that, A or AA. And then there's the 2-year phase-in for the requirement to have at least one accessible scale, at least one accessible table if you use them for medical diagnostic purposes. But everything else goes into effect July 8, 2024. And we will be happy to provide additional technical assistance from the Office for Civil Rights. Our enforcement mechanisms remain the same. You can submit a complaint through our OCR complaint portal. We will continue to conduct investigation of complaint received. We also can initiate compliance reviews of recipients without the need for a complaint to be filed. So the rule will be implemented through and enforced through the usual channels and authorities of the Office for Civil Rights. And next slide, please. These are some of the resources. There's a fact sheet that we also published on March 1st, which describes some of these same provisions at a high level. And you can find the full rule itself in the Federal Register. This is the link. Next slide, please. Doesn't look like we have time for Q&A. I need to hand it back to Allison to wrap things up, but just next slide, please. You can find information about, oh, it looks like it's closed. Okay, let me hand it back over to Allison. Thank you.
Okay, great. Thank you everybody for joining today's webinar. I think Molly shared some HHS OCR pages. And again, ACL also has a page at acl.gov/504rule. And I think both ACL and OCR will be putting a recording up online so people can understand exactly what's in the rule. I just want to re-emphasize what both Melanie said and what I shared at the beginning, which is a really important step that we will be taking over the coming months is making sure that people with disabilities and covered entities understand the rule and what's in it. And speaking for ACL, I saw many folks from ACL's disability networks on PNAs and SILs and DD councils, USEDS and others. And we will definitely be working with you to make sure you have resources since you have so much contact with disabled people across the country. For Molly, or I don't know if Molly Doris Pierce or Melanie, is there a place that if people have questions that they should send them to? As Melanie mentioned, this is just the first of many opportunities for us to share what's in the rule with you.
Yeah, Molly Doris Pierce is going to put that in the chat now. Oh, there, she distributed it. Sorry. Thank you.
Okay, great. And I will also put in the chat the acl.gov website. Again, I want to really thank Melanie and all of our colleagues at OCR. This rule is so important. It is truly transformational. And as Melanie said, this rule would not have happened but for the incredible input and advocacy of the disability community. This covers just so many areas. And we are going to work together in the really hard work of translating this rule into reality. So thank you everybody for joining today's webinar. We will be back in touch as there are additional opportunities, both to learn more about the Section 504 rule, as well as Melanie mentioned at the beginning, the Affordable Care Act's civil rights provisions in Section 1557. And we'll share that information with ACL's listserv. So thank you everybody for being on today. Thank you, Molly, for your presentation. And everybody have a great Tuesday. Thank you.